I'm Dr. John Iskander. Welcome to CDC Beyond the Data. I'm here today with Dr. Sarita Shah. Sarita, today we heard at Public Health Grand Rounds about multidrug-resistant tuberculosis. Could you remind our audience about some of what I call the basic complexities of tuberculosis as an infectious disease?
Sure, thanks, John. Tuberculosis is an ancient infectious disease, and it's been around for hundreds of years. One of the major challenges with tuberculosis is making an accurate diagnosis of TB. Even in the best of circumstances, the current tests we have for diagnosing TB require testing sputum to find the bacillus, and that can be missed in up to half of all cases. Treatment for drug-susceptible TB uses a standard 4-drug antibiotic regimen and takes about 6 months. It's very effective if taken correctly, prescribed correctly, and completed, and cure rates can approach about 95%. For drug-resistant TB, it's much more complicated. The treatment requires use of 4 or 5 drugs for up to 2 years, and the drugs have many more side effects. They cost a lot more, and they don't work as well as the drugs we have for susceptible TB.
We have some complications involved in both diagnosing and treating multidrug resistant or MDR TB. How big a problem is MDR TB in the world today?
MDR TB is an important public health problem and a growing problem. There are an estimated 500,000 cases of MDR TB that occur worldwide each year. One of the challenges with MDR TB, as we discussed, is the diagnosis of MDR. And of the 500,000 cases, less than 20% are actually diagnosed.
So a great global public health burden, and as you said, some complexities in diagnosing and treating it. Is there any hope on the horizon? Are there some new tools that are available?
There is hope. And for the first time in decades, we have revolutionary tests that can diagnose MDR TB faster in just hours in the laboratory, and they're not as complicated. They pretty much require the same things you need to do a sputum smear. And this test is called the Gene Expert. It works in about 2 hours to give you a diagnosis of drug resistance. And this has the great potential to provide a diagnosis to patients much faster than the tests we have now, which can take weeks and months. The challenge with the new diagnostics like Expert or others is it's part of a health system. And the test itself can give you results in about 2 hours, but the entire system around the test needs to be working well. Patients need to come to their providers in a timely way. They need to be close to centers that have this test. The test results then need to be fed back to providers in a timely way. So the whole system needs to be working well to really realize the full potential of the new diagnostic tests. We also have new drugs for MDR TB for the first time in decades. We heard about some of those today. Bedaquiline is the first new TB drug approved in over a generation here by the FDA. And it offers great promise because it has fewer side effects and does not require injections like the current drugs we have for MDR TB.
So we have some new hope for more rapid diagnosis, new hope for more effective therapy. What needs to be done on the global stage for us to really reap the benefits of these new tools?
I think, as we touched on for diagnostics, health system strengthening is really going to be at the core of realizing the potential of the new diagnostics and the new drugs, and also in preventing emergence of more drug-resistant TB cases. I think one of the fundamental principles in drug-resistant TB is prevention, and that begins by ensuring that cases with drug-susceptible TB are diagnosed and supported in completing treatment so we don't get more cases of drug-resistant TB. But then, if there are cases of drug-resistant TB which are sure to exist, infection control and prevention of transmission are critical. And this area has really been neglected for decades and is finally now receiving the attention that has long been needed. Infection control is not very sexy. It requires things like opening windows and wearing face masks to protect healthcare workers and other patients, but it really is fundamental to preventing this epidemic from expanding. I think realizing the potential of the new drugs will require a major global effort, and there are efforts underway, as we heard today from Dr. Leonhardt. I think it will require a concerted effort to bring drugs to patients, to reduce the costs of drugs, and to provide drugs in a supported environment where patients will receive continuous drug supply and will be supported to complete treatment until the end of the lengthy course and prevent emergence of further resistance.
So we have new technologies, we have new drugs, but we also need to go back to the basics of infection control and case management. Thank you very much. This has been CDC's Beyond the Data. Please join us again next month.